Just call ahead or order online if you want, or check them out on Facebook, however you need to contact them. And the car hops are ready to bring it out to you. Joining us on the phone is State Representative Harold Wright. Good morning.
Good morning, Vanessa and John. It's good to talk to you this morning.
Hey, good to talk to you. How are you doing this morning?
Well, I'm still alive.
Well, that's a win, right?
Yeah, I don't have the virus yet. Fortunately, been trying to watch out for that. But I don't know about you, but these, all the pollen in the air and everything, my nose and has been running.
Oh yeah, the allergies.
From all
yes.
that.
Oh yeah.
Allergy stuff. Yeah.
Yeah, allergies and wind and everything. Yeah, no, you're exactly right. We have had runny noses in our house. We're going through Kleenex left and right. Well, coming up, let's talk this morning. Lots of things, of course.
Are we 6 feet apart?
We're close enough. We're the budget, of course, was kind of a showdown.
No kissing, girl. No kissing.
No kissing, right? we were the budget showdown, right, between the governor and the House and the Senate. Kind of come to fruition, or is it still kind of up there? We're going to talk about that a little bit and talk about COVID-19 some more. The governor announced yesterday, April 24th, elective surgeries would come back into play, and are we finally starting to see a light at the end of the tunnel, I guess, from a government standpoint?
I think so. Yeah, I think we are, and we can talk about that this morning.
Conversation Corner is brought to us by Lucille's Roadhouse.
Quarantine never tasted so good. Lucille's Roadhouse has your lunch and dinner covered. It's easy. You've got 3 ways to order. Order online at chownow.com or from the Chow Now app. Order online at lucillesroadhouse.com, or you can give them a call, 772-8808, and order from their team. Then all you have to do is just park your car at Lucille's Roadhouse, wait for one of Lucille's car hops to bring out your order. To see the limited menu, daily specials, and more details on ordering, check out Lucille's Roadhouse Facebook page. Lucille's Roadhouse, taking it back to car hops and curbside service.
Hi, I'm David Toutfest with Toutfest Home Design Center. Today, it's more important than ever to stick together as a community and do our part. While we remain open as an essential business, we're also providing ways to shop safely in-store, online, or by phone. We offer 12 months interest-free financing, and we have access to nearly all the major appliance, furniture, and mattress brands. Toutfest Home Design Center, serving Western Oklahoma for 74 years in downtown Weatherford.
You know how proud we are to hear Made in Oklahoma. Well, Nutopia Nuts and More in Hydro is proud of their Made in Oklahoma products. Sweet garlic dill pickles, cashews, pecan clusters, brittle, pralines, chocolate of many kinds, along with Made in Oklahoma salsas and relishes. They also have 5 varieties of Oklahoma peanuts. When buying something for someone or yourself, make it special. Make it something made in Oklahoma at Nutopia Nuts and More. Inside Deer Creek Market, Hydro. It's worth the short drive.
This is State Representative Harold Wright, and hope your family's doing well during this difficult time of adjusting to the coronavirus and social distancing. We've done well in Oklahoma, limiting the spread of COVID-19 and limiting the number of cases, more importantly, the number of deaths caused by the disease. This is no time to let up. We need to continue to practice social distancing until we can be assured that it's safe to go back to work and that the virus won't come back even worse. If you have problems or need help with state government, call or email my office, harold.wright@okhouse.gov. Paid for by Friends of Harold Wright.
Susie Save-A-Lot here. Just reminding everyone that Save-A-Lot is still providing low-priced, affordable groceries and supplies during these challenging times. They want to make it easy for you. Unlike some stores, you can get in and out quickly at Save-A-Lot, so you're safer. If you are elderly and need assistance, just call 772-2336. and they'll provide curbside service. That number again is 772-2336. If you're elderly and need curbside assistance, at the Weatherford Save-A-Lot, located in the Weatherford Shopping Center on Washington and Main.
We're going to save a lot.
The new Van and John Show on the Coyote.
It's Conversation Corner, brought to us by Lucille's Roadhouse, and today is the burger special, Monday and Thursday of this month. So today being Thursday is 2 burgers and 2 fries, only $10 at Lucille's Roadhouse. State Representative Harold Wright is our guest this morning on Conversation Corner. And we were talking before we took a break.
I was just going to say we had that burger special the other day, and it's a great price. It's good burgers.
Can't beat that, yeah.
Not all about saving money.
No.
All about saving money. Speaking of money, where are we
Yeah.
at? Are we good? Are we funded for the rest of the year? Are we going to have to shut down the Oklahoma government?
Well, we're not going to have to shut down the government, I assure you of that. We are funded for April for sure. There is a disagreement between the Senate, House, and then the governor's office. You may have heard something about that on the radio and TV. The governor said that when we passed that bill a couple of weeks ago, we passed a bill to help fund the state government for the rest of the year based on, the Board of Equalization declaring a revenue failure. Well, then he didn't call that meeting, and he claimed that the House and Senate were playing games with that bill because we deleted some funding for one of his pet projects, digital transformation. And so he says he was upset about that. I think it's bigger than that. I think he's wanting cuts in next year's budget, and I think he's kind of holding us somewhat hostage, in order to get what he wants next year. That's kind of what I think. I did talk to the governor personally night before last, visited with him a little bit. He says he's just being honest, in terms speaking from his heart. And he said that because the House and Senate in that bill took out some of the funding he was wanting for digital transformation, he was pretty upset about that. And he was trying to work out something with the House and Senate to see if we couldn't come up with a plan.
When's the deadline for this? When does it have to be done?
Well, like the governor said, we've got until the end of May, but that's really not true because he needs to we got to get our budget for next year done the first week or two of May. So that's getting close to where we are right now. We have to finish our session by the last Friday of May, which, limits what we can do. I mean, you can't wait till last Friday to pass the budget. So we're going to have to do something before that. And the plan in the House and Senate, it just takes the House and Senate can do the budget. It's our job. That's specified in the Constitution. And we will do our job and come up with a budget. And the governor, then, if he doesn't like it, I guess he can veto that budget. But we can come back and we'll pass it with enough time to override his veto if necessary. So he really needs to work with the House and the Senate. That's where the budget starts. And he's the executive director. It's his job to carry out that budget. So hopefully he'll come to the table and get something worked out between what I've always said, three legs to the stool: the House, the Senate, and the governor's office. So we'll see what happens.
No, it'd be fun to watch for sure. Hopefully not too much drama. Hey, I saw Representative, is it Krieger? Is it Lundy Kicker?
Greg
Lundy.
Kiger.
Oh, Kiger. There you go. I was looking. They kind of wrote a letter, and then I've looked at. There's been several different letters kind of coming out of the House, but urging the Department of Health and Human Services to relax on some rules and regulations for daycares during this time. And that's kind of like, what are your thoughts on that? I mean, do you think this is a time when we should be kind of loosening some rules and regulations, or?
Well, I think we're going to see that. The governor in his meeting yesterday, and I watched the statewide, press conference, and then I was on a conference call with the governor after that. And I think, it looks like based on the curve that they were looking at initially, it's not nearly as bad as it was thought to be. The number of hospitalizations are down, and the number of viruses detected are down, and so I think you're going to see a loosening up. The governor said that he's going to allow elective surgeries starting on April the 24th, and I think you're going to see, particularly some of the rural areas of the state, he's going to allow for. Still going to want social distancing, but opening of some businesses on a limited basis with a plan. And I think you're going to see that by or around the 1st of May. And if this curve continues to level out the way it's been projected, I think that we're going to be safe to do that. But we have to be very, very careful. We don't want this thing to come back. If you look at the numbers, the virus COVID virus is able to spread pretty quickly. And in the metropolitan areas, you've got a lot more cases, obviously, than you do in the rural areas. But I was looking, somebody asked me the other day, if we could tell what towns that those virus viruses were detected with the tests, and there's 7 of them in Custer County. 5 of those are in Weatherford, or were in Weatherford, 2 in Clinton. Now, keep in mind, we know that 5 of those cases occurred over a month ago, or about a month ago, and over the 14 days. So the fact that there's only been a couple more cases in Custer County since that first started a month ago, that's pretty good. And like in Beckham County, they've only had 2 cases there. One of the outbreaks, though, that's occurred, which is interesting, is in Caddo County. Binger, which is a little bitty small town. Most of us are aware of Binger if you go through on 152. It's in Caddo County, but it's pretty close to Weatherford. It's just a few miles, I think about 30 miles from Weatherford. But they have 17 cases in Binger, and the reason for that is the nursing home there has 7. They have the bulk of those in the Binger nursing home. And apparently, someone brought the virus into the nursing home, and unbeknown to them, and has created the problem there at the Binger nursing home, which has got the numbers in Caddo County all the way up to 35. But half of those, more than half, are out of Binger.
Wow.
So that shows you how fast the virus can spread if you have isolated area where people come in and work in a nursing home and spread that virus. So that's why it's so important that we keep people out of nursing homes as best we can.
But I still think, don't you think the second we release this whole shelter in place, or we start moving back around again as a community, that we're just going to be starting all back over?
I know. How with it being around at all, is that going to be safe is what I'm wondering. I guess we're smarter about it?
I think we just have to be careful. It doesn't mean you just go everywhere and do everything. I think you have to be somewhat responsible. There is an element of responsibility involved in this deal, and there is some risk.
But is that the rest of my life?
You go out, well, here's the thing. Flu is also a risk, and I'm not putting the COVID virus is more contagious, apparently, than flu, and they have a vaccine for flu.
Mm-hmm.
But the point is there's some risk involved no matter what you do. And I'm not saying that we just open things up tomorrow. I think you got to do it in a smart way. And I think that's what the governor's saying, is we got to be smart about it. I think in the metropolitan area, it's going to take longer. I think you're going to see restaurants still closed in Oklahoma City for, maybe through the month of May. If things continue to level out, maybe those places will be able to open. I think in the rural areas, that I think you're going to see some places starting to open up that are non-restricted, like restaurants. But I think you got to be smart. Don't go there if you're concerned. You don't have to go there and eat.
Mm-hmm.
You go there and be careful about it. Hopefully people working there will continue to wear masks. A mask does not help the person that's wearing it from getting the virus. It helps you for keeping you from spreading the virus to other people. That's the reason for the mask. And that's a misnomer, because a lot of people think, well, if I wear the mask, it's going to keep me from getting it. No, right. It won't, because you get the virus through your eyes mostly, and on your face, and eventually that's how you get it. But the mask keeps it from spreading to other people. So you would hope that people working in those places would wear masks and wash their hands and all that. And that I think, you're going to have to decide whether you want to go there or not. And if you're an elderly population, he's saying you're going to have to stay in place longer. If you're more vulnerable, and it's a fact that people with other kinds of problems are more apt to have. It's like 67% of the deaths in Oklahoma that had a comorbidity, morbidity. In other words, what that means is they had something else wrong with them before they got the virus, like heart disease, for example, maybe, or diabetes, or other underlying problems like COPD would be one of those. It certainly
absolutely
could be if you got that. If you got the virus and you have COPD, I think, and you're elderly, it would be tough to get through that. But they are finding ways to help and deal with this as well. And I think that's helped keep the death rate down in the United States.
Completely agree with all that. I was my question, I guess, is if we are, surely I'm going to be able to go to a restaurant again at some point. Surely I'm going to be able to do this or that. But when am I going to be comfortable going to visit my grandparents? I think that's the one thing you feel like you're missing and you want to go do. But at the same time, you do not even want to be remotely responsible for something tragic happening there.
Well, I think it's going to be another month or so before we're able to go do that. That's my thought about it. If the curve continues to stay down, and as we open things up, we don't have another major outbreak of some kind, I think that at some point, maybe at the 1st of June, you may be able to see your grandparents, or elderly people in a place where they live. But we want to be very careful about that. I know that the state health department's going to be watching that really close. They're not going to allow that to happen. If there's any chance that some of those people could get, contact the virus, and that's what I think you're going to see happen. The other thing is whether we're going to allow people to get together in crowds. Some people are saying, it's going to be next year, the 2021. I just don't think that's going to happen. I think you're going to still see football in the fall, and it might be delayed a little bit. You're going to see the university going back to school in the fall, those kind of things, unless they're just, this thing continues to get worse for some reason.
When you're saying that when they do decide to open up the state, and then now we can do the salon thing, and the restaurants are open, and it's just up to us, it's if you still don't feel comfortable, and stay home, and it's just up to us. But so are you saying that if this happens, and there's still some of it out there, and then all of a sudden, just like it was, there wasn't very many, and then all of a sudden it just shot up, and then it was doubling and tripling. If that happens again, are you saying it'll just be like, okay, let's, it's a free for all, try and be safe, but we're open?
No, I think if it gets bad again, I think you're going to see a shutdown again. I mean, if it really got bad again. I mean, I don't think that. I'm just saying that if the curve does not go up and it stays flat, then I think you're going to see things kind of start to open up with some responsibility. At that point, that's when you're responsible. The biggest fear I have is that this fall, for example, if we start having outbreaks again, that could be very detrimental and shut things down for even a longer period of time. So we've got to be very, very careful about that. But I do think, I guess my point I'm trying to make is that we have to be very careful. There's a little bit of a risk, but there's a risk about living no matter what. I mean, are you going to go out, quit driving because you've had a wreck or someone's killed in a car wreck? I think if you're so afraid of life, then that's something you have to deal with no matter what.
Yeah. In my mind,
I'm not.
I worry about doing it too. In my mind, I just worry about doing it too early, just because, that sounds great, and I'd love to be able to say, hey, in a month everything's open, and let's just try and be careful, and and those kind of things. But then it's going to be so annoying to me if no, that's not going to work, and things start to increase, and then now we got to fall back again. That's the only thing that's bothering me. I'm just like, oh gosh.
That could happen no matter what. I mean, let's face it, no matter how long we stay, if we stayed the way we are right now for the next 4 months, that could still happen. At some point, we're going to have to move out of this deal. Our economy, there's a balance here between the economy of our country and, we're already looking at major, maybe equal economies of the Great Depression right now if we don't get out of this thing. And so there's a balance there that you want to try to find. And I think the last thing people want is for this thing to come back or get worse again. Now, they are working on a vaccine, and I think that if they come up with a vaccine, that will help a lot to deal with it. Also, I still think that in treating the disease, that, in my opinion, and I'm not a doctor, but just basically what I've read and seen, that hydrochloroquine is a solution to dealing with the problem. And it seems, based on anecdotal evidence, that it's working with many of the patients that are taking it, a combination of a Z-Pak and hydrochloroquine, which hydrochloroquine has been around for a long time. It's a drug they use to treat malaria, and they also use it to treat certain types of arthritis. And it's a proven drug with very little side effects. So if I got the disease, I would ask my doctor. Of course, it needs to be done through a doctor, but I would ask my doctor to prescribe that for me if I got the disease.
Well, if anybody wants to reach you, talk to you personally, what can they do?
Well, they can call me at my office at the Capitol, or go online with my email address at harold.wright, OKHouse. Harold.wright at okhouse.gov. I had to think about that a second. But anyway, appreciate the opportunity of being on. Anything else you guys have, or anybody have any questions on the phone this morning?
I think we are good for today.
Okay, sounds good.
Well, thanks again for
Y'all
chatting
have
with
a good day. Stay away from the virus.
Yes, exactly. Yes, we'll try our best. Wear the masks if you have to go out. Protect others. Thanks again, Harold.
Yeah, we'll talk to you next week.
Sounds good. Conversation Corner is brought to us by Lucille's Roadhouse, Airport Road in Weatherford. 2 burgers, 2 fries.